Good evening, everyone. My name is Kim Jones, and I'm the coordinator for Healthcare for All Cabell County. We're one of 4 regional groups around the state that, along with our sponsoring organizations, form the West Virginia Healthcare for All campaign. Our campaign has one goal: working to win the right to quality, affordable healthcare for all West Virginians. This is our 4th and last candidate forum on healthcare, and we are so grateful for all of our candidates for joining us. And now I'd like to introduce the moderator for tonight's forum from the West Virginia League of Women Voters, Betty Barrett.
Good evening, and welcome to the Healthcare for All Cabell County Candidates Forum. This evening's event will focus on the status and future of healthcare access and affordability in West Virginia. This is the last of 4 statewide candidate forums organized by the Healthcare for All West Virginia campaign, sponsored by the following organizations: the West Virginia Citizen Action Fund, West Virginians for Affordable Health Care, West Virginia Center on Budget and Policy, and the West Virginia League of Women Voters. The 4 Healthcare for All West Virginia community partners are Wood, Cabell, Barber, and Kanawha counties. I am Betty Barrett, a board member of the League of Women Voters of the Huntington area and the West Virginia League of Women Voters, and I'm the moderator. All of the sponsors are nonpartisan, nonprofit organizations committed to many issues, including improving access and affordability of healthcare with informed and active political participation in our communities. Thank you to all of the volunteers and sponsoring organizations that made this evening possible. Thank you especially to the candidates who are with us tonight. Thank you to all of you in our audience. All candidates for the United States Senate and House of Representatives from West Virginia District 3 were invited, and 2 was accepted. Because their opponents did not accept our invitations, these candidates will make a 5-minute statement rather than answering questions. We hope that they will respond to our questions. They have received the questions and rules in advance. Our timekeeper is Laura Foster. She will be clearly visible to the moderator and the candidates. We are expecting their compliance with the time limits. This is a forum, not a debate. Therefore, there will be no rebuttals. It's now time to officially open our forum with opening statements from the candidates. The districts, the West Virginia House of Delegate districts included are 16, 17, 18, and 19. There are 3 seats available from District 16. 2 of the 6 candidates are with us. From District 16, Democratic candidate Dakota Nelson. Thank you, candidate Nelson.
Thank you very much for having me. I appreciate the opportunity.
You have a minute for an opening statement.
Well, folks, I'd start by just saying that in any of these cases, it is really, really important that we have gotten to this point of identifying the absolute necessity of providing healthcare to all. I really, really hope that we get to the bottom of exactly how and really talk a lot about what we can do to make this possible. So that's what I'm really excited about. I myself plan to hopefully get the chance to touch on some tax proposals that really open up the door, and they're nothing new. We gave a lot of tax breaks to big out-of-state industries over the last 15 years, and I want to look into reversing some of those and putting that money into healthcare.
Thank you, candidate Nelson. From District 16, Democratic candidate for Sean Hornbuckle, you have 1 minute, Sean Hornbuckle.
Awesome, and thank you, Betty, for that introduction. My name is Sean Hornbuckle, representing the 16th District, which is most of Cabell County, a little bit of Lincoln County. And I've had a great time representing you all at the legislature. I am a dad, a financial advisor, and a coach. And I am wanting to serve you all again at the People's Capital. So, for about 3 years now, I have branded my campaign as Forward Together. And being one of the few candidates who is, endorsed by both labor and business, but also taking a liking to, community issues, LGBTQ, communities of color, law enforcement. I truly believe that we're in all of this together, and that's how we have to move forward. And last but not least, healthcare is right, and we need to make sure that everybody knows that, and we have policy and legislation that mirrors that. Thank you so much.
Thank you, candidate Hornbuckle. There are 2 seats available from District 17. 2 of the 3 candidates are with us. From District 17, Democratic candidate Jeanette Rousey.
Thank you. I'm happy to be here. My name is Jeanette Rousey. I am a Marshall University graduate and a small business owner. And my professional and volunteer life for the past 30 years has been dedicated to the well-being of children, including child abuse prevention, child mental health, and working with families to achieve the best outcomes. My priorities for running as a challenger to one of the 2 seats in this district are to stop the exodus of our young adults from our state, to fully take on the addiction crisis in our state, and most of all, to serve as a voice for children. Every decision I make will be centered on how it impacts the well-being of children, and healthcare is very central to all of those issues. So I appreciate the opportunity to be with you tonight.
Thank you, candidate Rousey. From District 17, Democratic candidate Chad Lovejoy, you have 1 minute.
Thank you, Betty. My name is Chad Lovejoy. I currently serve in the West Virginia House. I'm running for a 3rd term. I want to say thank you to Healthcare for All and all of the supporting partners. I decided 4 years ago I wanted to run as a father of 4. I wanted to try to give my kids the best chance to stay here and make it here. And so I'm proud of what we've accomplished in 4 years, but there is so much more to do. Since I've been elected, I've been supportive of your agenda. I'm wholly supportive of the 2021 West Virginia Health Agenda, and I think I'm positioned to be a good ally. I have experience with the process. I serve on 2 committees through which a lot of these bills will go: Judiciary, Banking, and Insurance. And I have made a focus in my service one of the big social determinants in healthcare, and that is food insecurity. I founded the House Hunger Caucus and passed a number of bills to help reduce that, and it's going to be something I'm going to talk about tonight. Thank you for having me again.
Thank you, candidate Lovejoy. There is 1 seat available in District 18. 1 candidate of the 2 is with us. From District 18, Republican candidate Evan Worrell, you have 1 minute.
All right, thank you, Betty. I appreciate it, and good evening, everybody. My name is Evan Worrell. I am a current delegate in District 18 and running for re-election for my 2nd term. I'm a healthcare consultant by trade, and I'm a father of 6 children. So most of my decisions, all of my decisions, are based around my children. I've been supportive in the past of expanding Medicaid coverage for pregnant working mothers, supportive of dental coverage through Medicaid, and how we could afford that. I know we've worked hard on that the past couple of years for those different issues, and I look forward to talking to you all about the issues that we have coming up tonight. Specifically, as Betty mentioned in the beginning, accessibility and affordability. So I want to thank Healthcare for All, Center on Budget and Policy, the other partners for helping and having this candidate forum. I'm excited to go through these questions with you all. Thank you very much.
Thank you, candidate Worrell. There are 2 seats available in District 19. 1 candidate had accepted our invitation. Unfortunately, Jason Stevens has had to drop out because of a family emergency. But candidate Stevens, we really appreciate your interest. Next, we will have a statement from the candidate for the United States Senate, Paula Jean Swearingen. Since her opponent chose not to attend, she will have 5 minutes. Oops. Let us go to back to this. Next is the candidate from U.S. House District 3, Hillary Turner, a Democratic candidate. Ms. Turner, you have 5 minutes.
All right, thank you. My name is Hillary Turner. I'm running for U.S. Congress in West Virginia's 3rd District. I'm a mother, and the health of my family is extremely important to me. I know what it's like to not have health insurance. I know what it's like to be worried about paying a medical bill. And our healthcare system in America is quite frankly broken and not working for many Americans. Just to give you guys some numbers. Well, first of all, I just want to state that I've been supportive of universal health care for a very long time. And I currently support Medicare for all as it stands, but there are different ways to get to universal health care. And I know sometimes that seems like a long way off, but I think it's important to keep pushing forward towards that goal. And just keeping in mind that the United States is the only industrialized country in the world that does not currently guarantee healthcare for free to all of its citizens. Just some numbers for here in the United States. From a study out of Yale University, there are 68,000 Americans who pre-COVID that die every single year from lack of healthcare. And additionally, there are 500,000 families every single year in America that go bankrupt from medical expenses. And in my view, healthcare should not be a for-profit industry. That is part of the reason why our healthcare costs have skyrocketed, because of greed from the pharmaceutical industry, the health insurance industry, and hospital administrations. And when you have a state like West Virginia where you have a lot of poverty, healthcare a hospital might not even be a profitable thing. We've actually had lots of hospitals in West Virginia close over the past several years. One recent hospital that closed in my district was in Bluefield. And so I talked to a young woman in that area, and people in that area have to, if somebody has a medical emergency, they have to drive 4 hours to Charleston or Huntington or even to a hospital over in Virginia to get healthcare. And that is absolutely ridiculous. And I think in addition to Medicare for all, I would also support really investing in rural medical centers and facilities, because a lot of people in our rural areas live too far away from a medical center to where they can't access emergency medical services. And so that is posing a great risk to our people here in West Virginia, where they can't reach emergency healthcare in a reasonable amount of time. So I really think that we need to train more doctors and invest in healthcare and make the health of our families and communities one of our highest priorities in the United States and here in West Virginia. And if I'm elected to Congress, this will be one of my top priorities, to literally fight for the lives of the people in my district and make sure that people have access to the healthcare and the medicines that they need to survive. And this is, to me, it's a humanitarian issue, it's a moral issue. And, people should not be getting rich off of our private healthcare system while we have so many Americans that are really struggling. So I think that we really need to look at universal healthcare, making sure that we have proper investment and doctors, nurses that we need for our people. So if anybody has any questions about that, I'm happy to talk with people, about this further. in the future, you can reach out to my campaign, and I'm happy to talk to you about healthcare.
Thank you, candidate Turner. We appreciate your attendance here. We have next, as we had for West Virginia, Pauline Swearingen. You have 5 minutes, Ms. Swearingen.
Thank you. Welcome to my couch. This really solidifies that we need Appalachian broadband. I mean, broadband expansion in their state. Everything kind of wigged out with my internet service. But, you know, I'm with Hillary. I'm a really staunch advocate for Medicare for all. Not only does it make moral sense, but it makes economic sense. It's been proven that it would save this country money. And one thing that I do like about Medicare for All too is there's just transition for people that do work in insurance companies, and it's more comprehensive. You know, it's more comprehensive. It also provides dental, vision, and hearing services to folks. And you know, this is one of the richest countries in the world, and healthcare is a human right. There's too many people in this country that have access to insurance, but they do not have access to health care, and they still can't afford their high copays and deductibles. And I do have a professional background with medical office management and medical billing, and I've seen on the back end how insurance companies dictate on how healthcare providers practice medicine, and I've seen what a monopoly it is. So it's just important. I mean, Hillary, talked a lot about it. I mean, it's really important here in West Virginia because a lot of our folks are on Medicare and Medicaid already. And, with the Part D deductible for our elderly in our state, it would eliminate that. And they the elderly in our state tend to get a raise in Social Security, but their deductible raises every year. So that's really not fair. And, with the addiction epidemic, it would play a role in helping end the addiction epidemic because people would have access to health care and they wouldn't have to go and pay cash at clinics, and also they can get into long-term recovery centers. There's just so many things about this bill that I get behind, and it's so comprehensive. And we're one of the richest countries in the world, and West Virginia is one of the poorest and sickest states in the nation. And I really do believe that healthcare is a human right. And as much as we've paid a heavy price for the Industrial Revolution, the least we can do for the sick and the elderly in this state is make sure that they have healthcare.
Thank you, candidate Swearingen. We really appreciate you being here with us. Now
Thank you. I appreciate it.
To ask all the House of Delegates candidates to answer questions that we have provided to them in advance, prepared by the organizations that are sponsoring. The order of speakers will be rotated. The first question is, with West Virginians experiencing some of the poorest health outcomes in the nation, what do you feel can be done to improve the long-term health picture for West Virginia families? What would be your priority areas? We'll start with Sean Hornbuckle with 1.5 minutes.
Well, thank you, Betty. I'm not sure 1.5 minutes is going to get it for this one. I'll try. So first of all, I think that we absolutely need to prioritize rural districts and also urban districts. I think myself and my colleagues have done a pretty good job. We can always do better, but trying to expand telehealth and reaching out to rural districts. Very, very important. Have a lot of population out there. Urban districts get left behind as well. What happens is because they're near health centers, sometimes they sort of get swept under the rug, but more often than not, they cannot afford those services. So we've got to do a better job of having a sustainable model that's going to be able to reach lower economic communities. As far as long-term, we really have to focus on our children and our adolescents. Children as of 2018 in our state, 18.5% obesity level. Adults, conversely, also 39.5% obesity level. So actually, talking with one of my good friends in town, Sam St. Clair, he talked about a German health model to where they have across their nation a sports model, sports, physical activity and wellness. So I actually have a bill House Bill 4901 that I've introduced, the Mountaineer Games Sports League, which is meant to enhance our physical wellness, activity, and trying to reach everyone. Because what happens as well is once you're aged out of high school, there are no outlets to stay healthy, active, and overall wellness. So I think we need to look at something like that outside the box.
Thank you, candidate Hornbuckle. The next candidate is Dakota Nelson, 1.5 minutes.
Thank you. Well, I think what we have is a multi-pillar, the need for solutions on all fronts, as far as realizing that, access to get in the doctor's office is part of it, of course, but then having, the goal to write legislation to make sure our prescription drug prices are attainable. But really, to start, I think at our basis, we have to have the courage to look at our budget. We all too often get by with talking about what we want to do, and that's really easy to do, not realizing that we don't really have the budget to make these extra things happen, or they likely already would be happening. And so what I would like to do is, use the priority of healthcare to help us understand that our budget and our tax codes are moral documents. And this is why, because when we have these huge tax giveaways, we lose the opportunity to fund these incredibly vital programs to keep our people healthy. And as mentioned before, to keep our economy healthy.
Thank you, candidate Nelson. The next candidate is,
And vibrant, which other
Roy.
great candidates we'll be talking about.
sorry about that. Chad Lovejoy, you have 1.5 minutes.
Thank you, Betty. I think there's 4 things that I would say we need to commit to. Number 1, we need to commit to a data-driven approach, collecting data, measuring it, setting goals, and having accountability for either meeting or failing to meet those goals. Number 2, we need to commit to increasing access to healthcare, which is kind of the whole purpose of this evening and the health agenda. I think that involves making permanent the advances we've made during COVID with telehealth, the CHIP buy-in option, Medicaid buy-in option, and also expanding the scope of benefits like we did recently with dental. Number 3, I think we need to commit to transparency. We need to figure out all the money that we're spending in West Virginia on healthcare. Where is it going? How much are the managed care organizations taking? And are they actually managing or just taking the money that could be used for healthcare? Number 4, we need to commit to invest in community health and social determinants. So I look here locally, programs like Maximus, where we have there at Cabell, community health workers are there. They meet with patients, and not only do they help them with the process of the Medicaid, but also connecting and follow up with primary care physicians and community-based organizations. We have Faith Help Appalachia in both Westmoreland, Highland, and I think that's a great one that we could model. And finally, on those social determinants, we got to dig down below to the issues: hunger, homelessness, our elderly, disabilities, racial disparities, and that's where we need to spend our time. That's where we can make a change.
Thank you, Delegate Lovejoy. Next candidate, Jeanette Rousey, 1.5 minutes, please.
Thank you. In addition to the solutions that have been put forth by my predecessors here tonight, I know that we need to protect Medicaid and the Affordable Care Act on the federal level, and we also need to match those programs to the fullest extent by state dollars. Reducing the rate of our uninsured West Virginians and expanding addiction services, as well as providing access to wellness and birth control. These were lifesavers, and we need to make sure that we do protect and build on the ACA. In the bigger picture, I believe that we need to seriously take on poverty as a determining factor in poor health outcomes. If some of those of us who are old enough to remember, the Medicaid and Medicare programs were part of President Lyndon Johnson's war on poverty in the mid-1960s. This also created programs such as Head Start, Meals on Wheels, other programs that really did reduce the poverty rate in our country until a lot of these programs were defunded in the 1980s. And we're now, as we see with COVID, we're living through what happens when our safety net is slashed. So I believe that it's our choice as a state, it's our choice as leaders and voters to reverse that trend of poverty and commit to and invest in a healthy West Virginia.
Thank you, candidate Rousey. Next, we have candidate Evan Worrell, 1.5 minutes.
Thank you, Betty. I appreciate it. Thank you very much. As you talked about in the opening remarks about accessibility and affordability. So we talk about accessibility. Of course, broadband is the biggest issue in this state, in our rural state. We need to focus on expanding broadband. And the reason why is because we need to focus on expanding telehealth services. You know, we have one of the QHCs around the state, and we need to make sure that those centers are being utilized for telehealth services for people to be able to come into instead of having to drive an hour, 2 hours to go to their doctors, for example. We also need to look into our school-based health centers, for example. And I think regardless of an insurance status, I think not only are they for the students, but they're there locally. I think they need to be potentially opened up for individuals to come into and be seen there as well. As far as long-term health picture, social determinants is one of the biggest key factors. If you're not eating, if you're homeless, whatever the case may be, those types of information needs to follow you into a healthcare provider's office so that they're aware of that, so of those situations, and they can maybe help for that as well. And then one of the biggest things we need to look into is the cliff effect of Medicaid. It's something I've been working on all year as a Medicaid buy-in option. I think what happens a lot of times is people fall off these services because they can't afford, or they make too much money, for example. They can't afford private health insurance, and they're really being left behind. And that's factoring into the rest of their lives, and not only their lives, but also their children's lives. So it's something we need to look into as well. Thank you.
Thank you, candidate Worrell. We now go to our second question. Given COVID-19, how do you propose we protect our students, teachers, and school service personnel, while at the same time providing equal access to a quality education across the state? The first candidate to answer is Dakota Nelson. 1.5 minutes, please.
I'm sorry, ma'am, could you repeat it?
Yes. Given COVID-19, how do you propose we protect our students, teachers, and school service personnel, while at the same time providing equal access to a quality education across the state?
Well, we have to make sure that our schoolrooms aren't treated like an alternate reality. And so it seems that there's an idea of an easy fix, and I don't think this virus really allows for that. And so the truth is that we just got to put a lot of money into it. We have to put the money that these children and their health and that these working people deserve. And so, I mean, I think we continue with realizing what's working thus far and what we add to in the way of dividers, in the way of, you know, using this situation to answer a problem that was already there, which is student to teacher ratios. And so we take a very competent look at what we can do to spread kids out, keep their breathable germs off of one another. And a lot of that is going to take the type of investment that West Virginia legislatures have went the other way from for a long time. And so it's prioritizing the health and the safety. And then after that, it's really just putting the money to work. But first, we got to put that money there, and I'd be a strong advocate that they deserve to, and it's our best economic choice going forward as well.
Thank you, candidate Nelson. Next is Chad Lovejoy, candidate Chad Lovejoy.
Thank you, Betty. So it comes down to an issue of balance, right? We all kind of, I think, have the same goal, which is the safety and well-being of our children and of our personnel in the schools. And we know that if we shut everything down, we will have children that will go without food, without a set of eyes every day, picking out, you know, maybe abuse and other situations, and not to mention the lack of education. So what is that balance? You know, and that's what we have to strike. Some of what we've done, I think, is good. Some is not. I think this map is a train wreck. We're sitting here in Cabell County, and we have a county health advisory, but yet we're green. And so I don't know how that works, but it probably has something to do with sports. On the other hand, if you sit down and talk with our instructors and our service personnel, they would tell you that, again, that evidence-based data-driven approach seems to be helpful. Physical distancing, limiting your class sizes, trying to isolate, test folks as they come in, and if they test positive, get them home to quarantine. Try to take those public health tools and align them basically with the education. I think that what we're going to have to do is pick up on things like PPE, sanitation, taking those special student populations, maybe that have folks compromised at home, some additional training for staff on the traumas that come from these kids. I have a hard enough time as an adult. I can't imagine some of the children. So we need to do more, but I think we're at least moving in the right direction.
Thank you, candidate Lovejoy. Next is candidate Jeanette Rousey.
There was an article this week by Kathy Slemp in the Charleston Gazette that I would recommend everybody take a look at. Our school boards, our parents, our educators, and our students are being forced to navigate through the wreckage of a government response that has not curtailed the spread of this virus. And the key that we have not seen lately is a clear, consistent, and credible government response that's based on science. The countries and the states that have successfully reopened their schools have robust testing and contact tracing systems in place, and we need to make sure that we get to that. Instead of the governor sitting on a stockpile of federal pandemic response money, our state needs to invest, heavily in what it's going to take in internet access for our students, in protective equipment, in the ventilation of our classrooms and our buildings to protect our students, to protect our school personnel, and especially, protect our families and stop the community spread of this virus. Thank you.
Thank you, candidate Rousey. So for this question is candidate, Evan Worrell, not last.
Thank you, Betty. So I think when we talk about this, when we talk about our teachers and our service personnel, realize that these are parents as well that have children at home. And I think that we need to really focus on their protection and their safety above all. And so we need to look at proper ventilation of our school systems, and we need to invest more money. We have the money, we've been given money from the federal government. We need to focus that on our school systems to provide PPE or whatever the case may be, because here's what I do know. I know that there are children at home today that do not have internet access. They do not have a computer. They don't have food. And sometimes they don't even have a parent at home all day long, and they're doing whatever they want. And the kids need to be in school, and they need to be in school for structure and stability. And I know that comes at a cost. And I think that's what we need to mitigate with that balance of how do we protect our teachers and our service personnel, but getting our kids back in school. I think one of the things that worries me the most is that we have kids, and these aren't, I'm not even talking about economically challenged children or children that might be in bad situations. Those are horrible. We need to focus on them, but it could be just parents at work. It's that simple. And what I mean by that is the number is so high that we need to focus on those kids and getting back in school. I'm very worried about what we're going to see this year with children not being in school and not being fed. So I think we need to focus on providing the PPE that's needed and whatever needs to happen in our school buildings to ensure an adequate and safety for all of our teachers, service personnel, and our students. Thank you.
Thank you, Delegate Worrell. Next is Delegate Sean Hornbuckle.
Yes, ma'am. I'm not sure what all I can add to that, not being duplicative, because Evan, Jeanette, Chad, and Dakota did a great job of answering those. But when we're talking about protection specifically, a lot of them hit the nail on the head. We have the cash. We have the money that was appropriated by the federal government to spend in this area to make sure we're protecting people. Number one, Chad has been a phenomenal champion on food insecurity. We're talking about protection with our service personnel, teachers and students. We have to pay attention to that because a lot of folks are going to fall through the cracks with not being able to physically be in the school building. Number two, I think we're doing ourselves a disservice if we're not going to take a harder look at mental health issues and making sure once we not just resume, but right now are doing everything that we can to alleviate some of those issues with people, again, not being in the school system, not being around their friends. I mean, this is a very important time for people that are growing up. So there needs to be a support system to coach them through that, but also to help the parents and the teachers and the service personnel. Number three, I also think that we need to be leveraging our non-traditional K through 12 learning sites. So using, the YMCAs, maybe even community colleges or universities to decrease class size. We know that that's very, very important, but using more facilities and buildings to make sure even going forward that we have a way better teacher to student ratio.
Thank you, candidate Hornbuckle. The third question, changing gears pretty much, we know that many women suffer from postpartum medical conditions that endanger both the woman and the child. Do you support expanding Medicaid to cover postpartum for up to 12 months at 300% of the poverty level? What else would you do to support the health of women and new parents? Candidate Lovejoy, you're first.
Thank you, Betty. The answer to your first question is yes. I was proud to vote in favor of Senate Bill 564 in 2019. That raised the eligibility for pregnant women to 300% for 60 days, but it didn't go far enough. It's the best that we could get a vote on. So I was glad, but we should have done more. It was intended, and I think we still have the same issue, and that's why the 12-month would be helpful to address low birth weight, infant and maternal death, postpartum depression, addiction. We're one of only 8 countries, and we're the only one that's a developed nation where the maternal mortality rate is rising. You think about that, it's rising. In 2020 in the United States, studies have shown that over half of the postpartum deaths occur after 60 days. So while it's great to have that coverage, we're not even getting to that other half. So I think that this specific policy provision would take less than $1 million to fund. And what we would see is great benefits, just like we have with other expansions. We're going to see decreased spending on un or undercompensated care. We're going to see increases in revenue on the services. And more than anything, we're going to see an improvement in human lives. Now, finally, on the other things I would want to do, parent education and support, making sure that we have a CHIP buy-in, that WIC is funded, and our Head Start programs are fully funded. I think those are going to give us the piece to carry through the rest of the year and then beyond.
Thank you, candidate Lovejoy. Next is Jeanette Rousey.
I do definitely support the expansion. I agree with everything that Delegate Lovejoy said. And I see a number of other ways that we can support the health of women, babies, and new parents. Things like parity in mental health care coverage. Things like substance abuse prevention, including a robust tobacco cessation program. One of the biggest causes of low birth weight babies is smoking during pregnancy. We need to look expanding our in-home visitation programs like Mountain State Healthy Families to give support to new parents. Beyond this, I would focus even earlier in the women's health cycle through teen pregnancy prevention and reversing the shortage of maternity care providers in our state. That's a real problem. As the only candidate on the state panel here tonight who has given birth, I think it's important to emphasize that at the very least, our legislature should not author and pass bills affecting women that are not based on medically accurate information and which would potentially limit access to birth control, outlaw in vitro fertilization, make miscarriages subject to investigations, or even criminalize our few OBGYN doctors for exercising their best medical and most humane judgment when a late-term pregnancy goes tragically wrong. So there are a lot of things that we can do.
Thank you, Jeanette Rousey. Next is Evan Worrell.
Thanks again, Betty. Yeah, so to answer your question, yes, I do believe in supporting expanding Medicaid for 12 months at 300% of the poverty level. I was proud to stand up on the floor 2 years ago, or in 2019, and speak in favor of Senate Bill 564, providing that 300% level for 60 days postpartum. But I think we do need to look at expanding that past 12 months, as we saw or heard from Delegate Lovejoy earlier, some data that shows why we need to do so. I think it's very important that we provide a support network, right? So we continue to work around the mother and their children through that 12 months, I think is very important. And to support health of women and new parents, I think it's very important to look into ensuring that there's a chip buying program, ensuring, as Delegate said, about the WIC, making sure it's funded, providing those types of support programs, as well as providing some type of maternal support, as well as, will it be in your local communities, I apologize, in your local communities with support programs as well. But I do believe in supporting that to 300% level. I think it's extremely important to show families that we are behind them as a state, and that we're there to work with them and to help them raising their children. Thank you.
Thank you, Candidate Worrell. Next is Candidate Sean Hornbuckle, 1.5 minutes.
Yes, ma'am. Thank you again, Ms. Betty. So first and foremost, I am very proud to say that I've always supported women's healthcare issues, and I will always continue to do so. I think it's very important to make sure that we have that protection, 12 months, 300% of poverty level. But I'm going to have to definitely go with Evan on this. We need to probably go beyond the 12 months. I mean, that seems a little short, and I think we definitely need to expand that. I also think that we need to work in collaboration with DHHR and to make sure that we do have not just more funding, but they're being efficient as far as hiring of social workers to be able to and learn more issues and provide a service to our new parents to help them get through this.
Thank you, Candidate Hornbuckle. Dakota Nelson, 1.5 minutes.
Yes, agree with everyone and happy to hear everyone's answer about providing that 300%. I think Chad said something important too, talking about when some of these health issues were arising, further down the road. And I really think that reflects our need to identify holistically how we do better by our women, and especially, in such important times. And so I think it really does connect all the way back to even our economic side of it. If we really start investing into a more progressive model of a parental leave, paid time off, that's the type of stuff that not only really helps in this health conversation, but it starts to advertise our state to the young, hopeful families that we really need to bring in and to set up shop here and to put their roots down. And so I think when we offer them this more holistic picture, not just saying like simple critical care, but hey, all together, we want this experience to be fantastic, and we're going to fund in a way that makes that possible. So I support it, and as others have said, going as further as we can.
Thank you, Candidate Nelson. Our fourth question: we know that good vision care is a critical part of increasing one's quality of life and being able to stay in or re-enter the workforce. It is essential to obtaining and maintaining employment. Do you support providing vision coverage for adults through Medicaid? First candidate to answer is Jeanette Rousey.
Yeah, thank you, Betty. I do support vision coverage through Medicaid, not only because our health insurance should really be covering the health of all of our sensory organs, hearing, vision, all of it, but because it is a jobs issue. West Virginia has by far the nation's lowest labor force participation rate. And a big driver of that is our large share of people with disabilities. I would have to look up how many, how vision is ranked, within the broader category of disabilities. But, I think that we need to make sure that we're investing in taking care of, correcting vision impairments for people who could otherwise work, and as well as people's health. And I think that we need to make sure that we're drawing down as a state the maximum level of federal vocational funding, and explore ways to change our funding formula so our state, with its large share of workers with disabilities, is providing the adaptive services that people need to move into employment. Delegate Lovejoy and I are both very familiar with a young man who left the state because he was not able to get a career and get the disability services he needs. So we need to invest in that and get people into the workforce and off public assistance when they want to work despite their disabilities.
Thank you, candidate Rousey. Next is Evan Worrell.
Thanks, Betty. So yes, I think we need to look into improving or giving access for vision. And I want to talk real quick about Senate Bill 648 that we worked on hard this year that provided dental coverage for Medicaid recipients. And we were smart about how we were able to do so. We actually tied it to an MCO provider tax so that we could fund it. But what was great about that is that through the $8.8 million that the state will pay, we'll receive $62 million back from the federal government to provide those services, I think to over 300,000 West Virginians for dental coverage. So I think it's only logical that we go into vision to do that next. Obviously, it'll even be less than that will be, than what the dental coverage would be. But I think it's very important, right? We talk about dental coverage, vision coverage. I mean, to be able to work and have a quality of life, I think it's extremely important. Right now, we only cover that up to, I think, the age of 21. But that's as a child. Who's to say that you have a parent that even takes you to get vision, take care of your vision as a child, and as you grow older, as your vision gets worse, and it wasn't taken care of or corrected at a young age, you're left as an adult for something you didn't have any control over. So I think it's extremely important that we look into providing vision coverage through Medicaid as well for adults, just like we did dental coverage this year in 2020. And I think that's something we look forward to working on in 2021. So thank you.
Thank you, candidate. Next is candidate Sean Hornbuckle.
Yes, ma'am. It is a resounding yes for me. As Evan stated, it's just a natural progression from what we've been able to work on. It just makes sense. It's going to uplift our citizens, enabling them to not just to enter the workforce, but to stay there and also be a deterrent from leaving our state. So for all those reasons, I would have to say yes.
Thank you, candidate Hornbuckle. Next is candidate Dakota Nelson.
Just as Sean said, resounding yes. I think what's important is how we make sure that we drive these home politically, because again, as humans, I think we all align on a lot of these things, and then somehow they have a way of falling apart when it matters most politically. And so I think, I believe it was Jeanette that mentioned, it being a jobs issue. For better or worse, we really find a lot more means to get things done when we start to open up voters' eyes and legislators' eyes to the economic impact. And so I think that painting these pictures of our public health as ones that really are the strongest possible investments that we could make with our budget, I think that really goes a long way to gaining momentum. I really hope that we can get to a point where logic takes over and we don't have to feel like it's Christmas morning when we have something as basic as vision taken care of. Thank you.
Thank you, candidate Nelson. Next is candidate Chad Lovejoy.
Thanks again, Betty. Like everyone, I agree. We need to add this coverage. We're kind of fresh on the heels of that dental expansion, so it's kind of fresh in mind. The way Evan described the funding mechanism, again, tying back to those managed care organizations, I think is pretty cool way to do it. On those dental, there's $1,000 cap. It goes to diagnostic and preventative services. And so you could have a similar type thing with vision. Right now, the only real adult exams that get covered with West Virginia Medicaid are as if you have an exam as part of a larger visual health concern, it's going to be medical in nature. So we're missing all that diagnostic and screening. And again, we're missing out on those federal funds that can help pay, for 80% of it. As Jeanette mentioned, it's good policy, to get people into work. When we deal with barriers to employment, we also reduce costs. If you end up at an ER with an eye issue, it's about 10 times more expensive than just screening it up front. So again, you can have an ounce of prevention or a pound of cure. And finally, above all the money, it's just it's the truly human thing to do. I mean, we want people to participate in our communities and our lives. And I can tell you, if you can't see as much as you can work around, you're missing that. And we can fix that if we'll just commit to making it a priority. So I hope we do so. Thanks.
Thank you, Chad Lovejoy. Our last question. We know that people of color are more likely to suffer from heart disease, diabetes, postpartum death, and many other conditions. What would you do to address these structural inequalities and improve health outcomes for people of color? The first candidate to answer is Evan Worrell.
Thanks again, Betty. Yeah, so I think one of the things I talked about earlier is accessibility. And when we talk about the FQHCs in our state, I do want everyone to know that we have the largest network per capita in the country of FQHCs of over 350. And the reason I bring those up in particular is that FQHCs actually see a higher proportion of people of color in their centers. And I think it's important that we continue to expand that when it talks about accessibility. And that's where I bring in the Medicaid buy-in option as well. I think we need to continue that path. I think that would also improve health outcomes for people of color through a Medicaid buy-in. I think it improves health outcomes for everybody through a Medicaid buy-in program so that people aren't falling off the cliff and losing their benefits when they make too much money, which really is not enough money. But I think one of the biggest things that I look at is the disparity of people of color that are referred to other testing. And so one of the things I'd like to look into is I think we need to look into racial and ethnic diversity of healthcare providers. Statistically speaking, people of color that are healthcare providers that typically go back in the communities they came from to work, and they care more about the community that they're in. And that's just something that I've seen through data is that that's typically what happens is that people of color are not given or referred to those additional testing. And I think that by expanding some type of opportunity for diversity in healthcare providers would help facilitate that through a long-term approach. Thank you.
Thank you, candidate Worrell. Next is candidate Sean Hornbuckle.
All right, so this is another big one. I'll try to speed through this as quickly as I can, but there that are social determinants for the disparate health outcomes. It's economic stability, physical environment, education, view community, social context, and also healthcare systems. The biggest thing here we're dealing with is actually the wealth gap, economic stability, that number one issue. When you look at how COVID was done or how it played out, it was because like 72% of frontline workers were people of color. They were not afforded the ability to be able to work from home. They was always out on the front lines. So by and large, it's an economic issue. But also, Evan talked about a really good point. We have a lot of FHQs and they do great jobs. But the one thing that we're not looking at, and I would encourage all of my fellow delegates and candidates to take a hard look at, is a lack of trust. This country, we have a checkered past at best. I'm sure a lot of you are familiar with the Tuskegee experiment from 1932 to 1972. That was literally our government and private sector working in collaboration to hurt Black people, injecting them with diseases, and they spread it to their families. So since then, there's just been a lot of distrust. There's a lot of other issues. I think we have to work on that, but also trying to help people economically.
Thank you, candidate Hornbuckle. Next is candidate Dakota Nelson.
Yeah, to follow up on Sean's point, I mean, history has gotten us in a situation that we're in, and so I go back to economics. We have a history of destroying the economic power of people of color, and I think we need to have a future of restoring it. However, I think that in these cases, our strength is in universality. And so when you realize, just like with picking up, women's strength, it is realizing where they stand economically. And it is a lot of our folks of color and our women who are working our minimum wage jobs, which another way to refer to them is poverty wage jobs. And, we pay a price. People of color pay a price when we allow poverty wage jobs to even exist. And so I think we really, really focus on how we bring up, what is it? Something about tall or high waters raise all ships. And I think that needs to be our goal economically, because when we talk about healthcare, it's always about access. Well, what really, really depicts access in the United States and in West Virginia? It's money. And right now, hardworking folks of color are not, if they're in the minimum wage sector the way a lot of folks in West Virginia are, then they're just not going to literally have that opportunity.
Thank you, candidate Nelson. Next is candidate Chad Lovejoy.
Thank you, Betty. If you look at the states that are doing better at improving health outcomes for people of color, there's four kind of key variables that seem to emerge. The first one is a smaller, what some call an insurance gap, some call, increased access to healthcare. That's a lot of what we've talked about here tonight. The second is a better system of collecting data on race and ethnicity in order to measure outcomes and to kind of target the areas that need attention. The third one Evan alluded to, which is an emphasis on workforce diversity in the healthcare setting. And the fourth one is a robust and dedicated Office of Minority Health. And on that latter one, I want to say that at least in the years I've been there, and I think Sean as well, our colleague Larry Rowe has every year introduced a bill to create a minority health advisory team. And this is a 20-member board whose sole focus is to collect this data, figure out how can we improve outcomes. It has teeth, it has accountability. And even though the governor put together kind of an impromptu panel during COVID, we don't have the force of law, of codified results and reports that I think we could do to make things better. Now, we got to move in the community-based. All right, here locally, we have Marshall's Minority Health Institute. They have partnered with a number of those community organizations to take healthcare into the communities. And I think that's going to be the key to making it better for all of us, particularly people of color.
Thank you, candidate Lovejoy. Last but not least is candidate Jeanette Rousey.
Thank you. Just to knowing that I was last, I was going to piggyback maybe on what everyone else has elaborated on. I do think our legislature needs to look seriously in an ongoing way, not just a one-time study commission, but looking at the data, as Chad said. If we're not measuring the problem, we're not addressing the problem. And our legislature needs to be more attuned to the disparities that exist in all of our systems. One of the areas that I'm is the role of culturally competent care providers, people who, come out of our medical schools, come out of our nursing schools, that can provide respectful, clear communication, to take, even if the terminology might not be the same that a patient is using as someone that the dominant culture is used to, make sure that they're communicating well, that they're taking the issue seriously, because one of the key components of that medical relationship is that cultural understanding. And I think it would be a small investment to make. We have to take it seriously to make sure that our care providers in these majority white communities are dealing respectfully and effectively with all patients.
Thank you, candidate Rousey. This ends our program. We're grateful to all of the candidates who were here and gave us such thoughtful and interesting answers to very difficult questions. We especially thank Paula Jean Swearingen and Hillary Turner, candidates for the United States Senate and House of Representatives, for being here and staying for the whole program. I'll now turn you over to Kim Jones, our excellent coordinator of these healthcare programs. Kim.
Thank you so much, Betty. We appreciate you so much and your input, and thanks to the League for letting us borrow you. You've been wonderful. And I want to give a special thanks to all the candidates for participating and for all the thoughts you put into your answers, and to everybody who joined us tonight. If you want to learn more about our campaign, please join us. You can look us up on Facebook at Healthcare for All West Virginia or Healthcare for All Cabell County. And basically just help us if you feel like volunteering and believe in what we're doing. You could definitely join our fight. And finally, please vote. Here are the dates to remember in West Virginia. October 21st to the 31st, early voting in West Virginia. Don't forget to bring your ID. October 28th is the deadline to request your absentee ballot. And November 3rd is election day, of course, and polls are open from 6:30 a.m. until 7:30 p.m. Don't forget to bring your ID. And November 3rd is also the deadline to mail in your ballots. So thank you all so much again for joining us, and please share this recording, especially for folks who are still haven't sent in their ballots and need to make a choice on important things that are going to affect their families. Thank you. Good night.